Welcome, everyone. Good morning. Thank you for joining today's Research Radar webinar, Inclusive and Accessible Transportation for All, hosted by the Minnesota Department of Transportation and the Minnesota Local Road Research Board. My name is Stephanie Tofty. We're excited to have our presenters, Camila Fonseca Sarmiento, also known as our MC today with the PowerPoints, William Goff, and Cadence Kushner. Today's webinar is part of the Research Radar series, sponsored by the MnDOT Office of Research and Innovation and the Local Road Research Board. Each month, we highlight research projects focused on a common theme. Before we get started, I'll read the Tennyson warning. This session will be recorded for those who cannot attend. If you have enabled your camera during the session, the recording may include your image, which is private data under the Minnesota Government Data Practices Act. You are not required to allow MnDOT to use your image, and there are no consequences for declining to do so. To opt out of the recording, simply turn off your camera. Okay, next slide, please. Can everyone see the slide? Or is it a little hazy? Okay, that looks okay. Thank you. MnDOT's Office of Research and Innovation manages more than 185 research projects in progress, ranging from local initiatives to pooled fund projects with other states, comprising both basic and applied research. We're here to help transportation practitioners determine whether new research is needed or if existing studies may solve your needs. Okay, it looks like the slide is getting hazy. I wonder if it keeps moving and pixelating. Is there anyone on the webinar who happens to know a workaround that might, like a way of hitting a reset button that might improve the quality of the visuals?
Why don't I try sharing?
Okay. Oh, one idea was to turn off the camera while sharing. So Camilla, if we try you again, maybe if you turn your camera off while sharing after Julie tries to share the PowerPoint.
Second. I assume you can see my screen.
Oh, now it's working. How did you do that?
This
is my supervisor, everybody.
Yeah, that's so remind me which slide you're on and I'll put it on that slide.
Sure. The second slide. So MnDOT's Office of Research and Innovation manages more than 185 research projects in progress, ranging from local initiatives to pooled fund projects with other states, comprising both basic and applied research. We're here to help transportation practitioners determine whether new research is needed or if existing studies may solve your needs, recommend the best research methodology for your project, access local and national funding sources, and manage your project from start to finish. The Local Road Research Board is a city and county-run organization that sponsors research and educational initiatives that address local transportation needs. New slide, please. You can stay up to date with our research by following us online and subscribing to our newsletters. We will send you website and subscription links as a follow-up email after the webinar. Next slide, please. Have an idea for a new project or a problem that needs solving? We're accepting new ideas on Idea Scale through April 1st. You can scan this QR code now to access Idea Scale, or we'll also follow up with the link in the email. Next slide, please. We funded 28 new academic research projects for 2026. To see the full list of new projects, scan the QR code here on the screen. If you have subject matter expertise on any of these projects and are interested in serving on the technical advisory panel, please reach out to our office by emailing research.dot@state.mn.us. Next slide. And now I'd like to introduce our presenters. Presenting Advancing Equity in Capital Investment Decision Making is Camila Fonseca Sarmiento. She is the Director of Fiscal Research at the Institute for Urban and Regional Infrastructure Finance at the University of Minnesota's Humphrey School of Public Affairs. She is also a scholar at the Center for Transportation Studies. At the Institute, she is engaged with research related to evaluating the economic impacts of policies, public budgeting, and public finance. Presenting mitigating community harms of dense highway infrastructure, spaghetti junctions, is William Goff. He is a transportation planner for the Minnesota Department of Transportation with over 30 years of transportation planning and local government land use planning and administration experience. And presenting improving transportation equity for all by centering the needs of marginalized and underserved communities is Cadence Kushner. They are the emerging practice planning coordinator in the Office of Transportation System Management at the Minnesota Department of Transportation. Prior to joining MnDOT, they served as the pedestrian and bicycle coordinator for the city of Minneapolis. Also available later on as a resource for the research phase of this project is Lisa Austin, who directs the MnDOT Metro District Center for Community Connections, which is an office that responds to community requests for non-transportation uses of MnDOT right-of-way, including enhanced landscaping, recreation space, public arts, and the airspace over interstate highways. Lisa joined MnDOT as a second career in 2008 in the Office of Transit, where she held positions including ABC Ramps Coordinator, Bicycle and Pedestrian Planner, and Safe Routes to School Coordinator. She has led many research projects over the years and currently serves as chair of the Center for Transportation Studies Research Council on Transportation Planning and the Economy. And we have reserved time after all three presentations have concluded for Q&A. So with questionable success, I hope to hand the baton to Camilla to present. Let's just roll the dice and see what happens.
Okay, let's see if this works. Are you able to see my screen?
Yes, looks great.
Perfect. So thank you so much, everyone, for having me today. I'm going to be presenting some results of the work that we conducted at the Humphrey School. I'm Camila Fonseca, but I worked in this project with Frank Dauma, PhD student Alan Roy, and professors Daniel Chang and Jerry Zhao. So kind of the background for this research is that there was limited research on the approaches that are used to incorporate equity in capital investment planning and in the decision-making process. So overall, there was not systematic research on like what equity means and what are the equity measures that are used across localities. So we kind of conducted a literature review and we found that equity is often associated with the allocation of benefits among various social groups, and that is typically based on their capacity to pay or related to the accessibility. So the places that they can reach, but it typically overlooks the existing disparities. When we look in particular into the capital improvement planning, what we found in the literature is like generally objectives are not specified, and because of that, they are not really like prioritized. Equity doesn't get prioritized in the capital investment planning process. Overall, the process rarely involves community input, and when it does, it is kind of it has limited representation of vulnerable populations. So it's always like the same people that participate are the ones that keep participating in the process, and that influences the final decisions that are made. So what we did, we first conducted a literature review to see what is studied, or like what are the kind of common themes that have been identified. Then we developed a survey across Minnesota localities, also Native nations. After that, we selected some cases as a case studies. And from there, we identified some successful practices for incorporating equity in capital investment decision-making. And after that, one of the questions from CAP members was how to assess trust in the community and how can it be developed in the community so that from here they can incorporate equity in their investment plan. So because of timing, I'm not going to talk about like all the findings. I'm going to focus on the successful practices that we had. And I'm going to talk a little bit about the part of assessing trust in the community. So one thing that I want to note here is that we are differentiating between equity and equality. So generally we see equality as providing uniform services to all people, regardless of their needs or regardless of their status, while equity really goes into that, but addressing historical and systemic disparities. So when we start kind of developing the survey and kind of getting the responses from the different localities, they typically refrain to the Title VI of Civil Rights Acts as their kind of policy framework for talking about equity. But that is really more talking about equality and less on equity. When we really move into that equity part, we see some of the localities talking about the Americans with Disability Act. So we want to make kind of that distinction. So looking into the successful practices, we identified 7 of them across the localities. Overall, I want you to know that equity is not like a one-size-fits-all approach. So all the practices that I'm going to be listing here must be tailored to reflect the demographic, the cultural, the historical, and the economic context of each community. And the other thing is like when we are incorporating equity in the transportation investment planning process, overall that has occurred to like a gradual accumulation of small changes, and that continues to evolve. So a lot of the things that I'm going to show you is like right now it is working this way, but know that localities and native nations are kind of like keep working on improving their current methods. They're trying to see which measures are better than the currents that they have. If the goals that they have actually are kind of a good goal to pursue, or if that also needs to be changed. So overall, it continues evolving, and it's like a very recent concept. So all the process that we're seeing are changing very fast. So when we talk about the first practice, assessing internal policies and practices through equity lenses, is that agencies are examining their policies and their guidelines. That includes project planning, their decision-making structures, the processes for public engagement, the processes used for fund to plan and select and transportation investment projects. So overall, these examinations are trying to identify and address the systemic biases and barriers that exist to incorporate equity in the process. And kind of overall, when talking with the different agencies, something that has been crucial here is kind of using like a third-party facilitators so that they can guide and they can mediate difficult conversations as this happen. One of the examples is the Met Council. Or like at the time we were conducting that study, they were conducting an assessment of the process to fund, plan, and select transportation investments in the council. This kind of examination of policies and guidelines is typically combined with equity training. So that equity training goes, or like it's designed for all staff at all levels. So it comes from the leadership to the planners, and it's looking to identify what are the biases and recognize that planners or the leaders may have those biases, equip the staff with tools so that they can understand how their own biases may influence their work or the things that they do at the organization. Some equity with regards to cultural competency and sensitive training. And like overall, what we see is that these practices kind of happen within the local-wide initiative that is aimed at fostering equity. One of the examples that we had of the equity training is in Hennepin County. They have been conducting and advancing racial equity training in 2019. So that was kind of a 4-hour classroom-based training for employees, and that kind of develop some awareness, develop skills, so that they can apply what they have learned in their work. About 95% of the Hennepin County staff are trained in this way. The second practice that we identified is conducting a community assessment to build an equitable transportation investment process. So here, what we were listening is like we're trying to do an inventory of the assets that we have in the community. And only one specifically mentioned, like community assessment. And this really is just mapping out all the community resources and assets that could be leveraged for development. So one of the things to note first is that this approach kind of focuses on the capacities and the potential that the community have instead of the deficits or like the needs that exist. So the framework is really more on building on the existing strengths. So typically the community assessment identifies kind of three main assets. So human capital assets, social capital assets, and physical capital assets. And all of these three kind of work together to bring you like a very comprehensive screenshot of what the community looks like. So when we look into like human capital assets, we're trying to look into like, what's the composition of the population? What are the demographics? What are the labor market skills? So this is looking into, do we have any people that can help us with construction? Do we have people that can help us with community engagement, right? So like trying to understand what are that human assets that we have. Another important group is local leadership. So it's looking into elected leaderships, but also into community leaders or those that are advocating for different community groups that can help the organization to kind of work with the community. The second is the social capital assets. So that's more looking into like the community history, the environment of the community and the relationships that exist. So one example is like looking into like health and social outcomes so that you can decide like how transportation can influence those outcomes. And the third one is looking into like physical capital assets. So that's not only looking into like the transportation system, like the roads that we have, the sidewalks, bike lanes, right? But it's also looking into like the context in which that happens. What are the hospitals, the community centers? Where are the places of worship where you can do some community engagement? So it really tried to like bring together like what are the assets that you have in your community, but not just focus on transportation, but like on the overall. Again, this is a very iterative process. You are understanding something. Maybe when you talk with a local leader, you learn something. So that also gets incorporated into that inventory. So it's kind of evolving a long time. Once you have that, you may identify what are the populations that have been underserved, excluded, or harmed by transportation decisions. And that varies across localities and native nations. It's really a key step for the transportation investment process to be equitable. So when we were doing this study, most of the factors that different organizations or agencies have been using for identifying underserved and excluded populations include race and ethnicity, the income level, the disability status, the age, so focusing on children or senior populations, if they have access to vehicles, their English proficiency. And when we're talking to like the Native American nations, it's the self-identification as Native American. So all of these different groups may face significant challenges in recent destinations, may have faced financial barriers, may have limitations in having, let's say, a driver's license, or any like difficulties in navigating the whole environment. So it's really important to understand the community and understand like what is that underserved or excluded or harmed by bad transportation decisions in your community. And again, these may vary across localities. Once you have identified that, you need to define equity in transportation. And this is very essential for building like a common understanding so that you can guide efforts going forward and ensure clarity so that there is kind of an alignment among the stakeholders that are working together in the project. And once you define equity, it also serves as a foundation for setting priorities, for adapting any processes or any like measuring systems, and to foster accountability. So when we conducted the survey across localities in Minnesota, we found that of the 11 county responses that we received, only 3 had definition of equity. And then similarly, when we look into like the cities that responded, we have 14 of them and only 5 provided a definition. So overall, there isn't kind of a common definition, like there isn't any definition in reality, but then when it exists, there is not common. There are some elements that are very common across them, and these are two. One is that they refer inequity in terms to access, accessibility, and safety. And it generally refers to all users of the transportation system. Very few localities actually refer to like a specific population groups, and they typically name them as underserved, overburdened, or vulnerable communities, and also call out for people with disabilities. I'm gonna here provide some examples. So we on the left part is the definition of that uses the Minnesota Department of Transportation. And on the right one is the one that is used by the Metropolitan Council, and this is in their 2040 plan. As I mentioned, this has been evolving. So now in their Imagine 2015 plan, that definition has changed. So as I mentioned, it continues to evolve. Something, let's say, from the Metropolitan Council is that before it uses like people for all races, right? Like the creation of options for people of all races. In that iteration, they kind of call out like specific communities. So excluded communities, especially the Black communities, Americans, Indian, and people of color. So again, this is something to consider when defining equity. Once that definition is done, it's very important for localities or native nations or agencies to develop like specific equity goals and objectives. They rarely exist based on our survey. And what we heard from the different organizations is that, well, the goal needs to provide like a general direction, long-term aims, and then the objectives have to be like specific items that are actionable, that are short-term, and that are measurable. So here we have an example of what the city of Edina has. The Hennepin County also has, and they manage that measurable or like targeting. So they have like, we have this baseline in 2017, and this is our target in 2040, for example. So that is very useful for the investment process overall. Once you have that, you need to determine like what are the phases of the capital investment planning process in which you will need to incorporate equity. So for the outcome to be equitable, you need a process that is also equitable. So ideally, you need to incorporate all the equity in all the phases of the process, but that is limited because of the staff capacity and budget constraints, and I really need some like heavy resources sometimes to get it done. So we identify like 3 phases of that process. So the first one is identifying transportation capital investment projects. So typically localities, what are doing is like a data-driven approach when we say these are some of the needs that we have, or like these are some investments that we need to develop. And then they pair that with community engagement. So it could be that they develop surveys that say which are the most important points for investment kind of going forward, and they have their people to respond. Or sometimes, depending also on the setting, if it's like a small setting, probably it's more doable, but it's in-person engagement. So it's really going out into the community and asking them about their feedback on those kind of projects that should be included for investment in their capital improvement plan. The second one is that once you have the list, you need to prioritize which transportation capital investment projects are going to be funded. So some organizations have been developing kind of a measuring framework that they provide some points to the different projects depending on measures that are related to the goals, that are related to the communities that they have identified as underserved or overburdened. So these typically is a multi-step process that combines spatial data and a qualitative approach. So they first kind of map out what are their needs, like what's the community in that need, or in that environment. They look into like different factors. Is it close to let's say a hospital, or right, like they are looking into that overall framework that I mentioned of the community assessment, and they are kind of putting some points for these projects. And then once they have that, they look again, they look again into all the projects, and they try to say like, well, this is the feedback that we heard from people, so maybe we need to move this up, we need to like lower this down in terms of the prioritization. So it's kind of a multi-step process. Some of the localities that have been doing this prioritization include the Hennepin County, City of Edina, the Metropolitan the Metropolitan Council, and the Duluth Superior Metropolitan Interstate Council. And then the last kind of phase where it could happen is when you're actually selecting the transportation capital investments for funding. So typically, in the localities, what they do is they provide the capital improvement project, and they have like one meeting so that people can provide their feedback, and that is all. But there are some localities that are creating kind of a community advisory committee or board, in which they have people from the community that provide feedback on the projects that are going to be selected for funding. So in that way, they not only have kind of the let's say like the official side, but also like the community part. One example of that is the Hennepin County. They have something called the Capital Budgeting Task Force. So that Capital Budgeting Task Force is individuals from the community that review the projects and provide some feedback to the council, and the council with that kind of informs their decision.
Camila, excuse me, this is Stephanie. We're having a blurry screen situation. Would you mind turning your camera off to see if the bandwidth can be preserved for the presentation? So sorry about that. Thank you so much.
No worries. Thank you. Yeah. And then the last part is going to be defining the equities for the elements for equity analysis. So this one really kind of helps you to guide and monitor the efforts. Again, the selection of these measures is very context sensitive. It reflects the demographics and the life experiences of the population in the specific locality. These are not statics. The idea is to monitor them and adjust them so that you can ensure that they remain effective. So one of the examples that we have is like income levels. Most of the agencies have been looking into like what's the income level in the area nearby the projects that are going to be developed. But that depends on the kind of locality that you're looking into. So here I have 3 examples. One of them is looking into like the median household income. That is census block data, and they kind of map that. They kind of have a distribution of that, and then they create some categories, and based on those categories, they provide the points for the project. Low-income households in the Hennepin County. So they are also looking into the areas of concentrated poverty that are defined within the census tract at 40% of the households are below 185% of the federal poverty level. So again, we're looking into like the income level, but we have 2 different measures. And then in the third example is that they are looking at the federally defined poverty threshold. And that threshold varies depending on the number of members that you have in a household. So it really depends on like which measure will make more sense for your agency. And I don't know if I'm out of time or if I have 2 more minutes to complete. Stephanie?
I think we're fine with time. Thank you.
Okay, great. Yeah, so those are kind of like the practices that we have identified across the localities. The second component that I wanted to touch on this conversation was how to assess trust in the community in general. So trust is very critical to engage the residents, especially those that are disadvantaged populations. So there are kind of like 3 main things that need to be clear when like how to assess trust. One is that you need to be clear about like trust in whom. Are you talking about like the government in general? Are you talking about like a specific agency, the Department of Transportation? Are we talking about like the public works department within a county or within a city? Or are we talking about like the trust that we have in a specific community member? So John Smith, that is the leader of the Department of Transportation in X city. So you really need to be very clear of trust in whom are you asking for in your process. Usually the trust level depends on kind of the perceived trustworthiness of the government agencies, and this is divided in kind of like 3 elements. One is the ability, which is like the skills or the ability to achieve the results. So people see this as like how well the agency will get the job done. The benevolence, which is like the belief that the community members have from government agencies that they want to do good for them. And then the third one is integrity. So whether the government agencies are consistently based on a set of principles. And then the third one is that once you have kind of collecting all of this information from your community, you have to create like a feedback loop, and that is kind of going out and communicate the outcomes that you have learned, so that people know like you're seeing them and you're hearing them. So in the paper, and I don't know if we can later send the links to the papers, we have created like some of the metrics and kind of the survey questions that you can use to evaluate that trust in your community. And this is coming from kind of a literature review, looking not only in transportation, but like in other settings, like how they are doing this and which questions have been proven to be kind of informative of the level of trust that exists. Once you have assessed that level of community, the trust in your agency, organization, a person, or of government, there are some kind of strategies so that you can build that relationship and generating kind of that trust loop. So the first one is really to start the relationship from the assumption that they don't trust in you. From there, you can start building that trust. The second is like partner with the community-based organizations, specifically those that are serving disadvantaged communities. They are the ones who know how to approach them. They already have like a level of trust with their community members. So you can partner with them and leverage that existing relationship that exists. And most importantly, like you need to kind of like trust in what they know, what they do, and pay them for the knowledge that they have. The third one is building in internal trust within the public agency. So this is more about like within the organization, you have your goals, you have your objectives. So make sure that all staff in the agency knows that, so that helps that when there is like a turnover, when someone is sick and cannot come, like people know like this is the whole organization and they are rooting for this. This is not only like one key person that is running this, it's like an organization as a whole. 4, focus on small wins. So this is kind of seen as showing up consistently to the meetings that exist and stick to what you have said you're gonna be doing. That also helps in building that trust. The 5 is to start with interpersonal trust building. So really like key staff should go to social events, get to know the local leaders, get to know the community, and kind of involve themselves in that communities. Overall, make the meetings fun. And so this one is looking more into like doing meetings that are less formal. And focus on knowing your community. So one of the examples that we have from Ramsey County is that actually they went out, they kind of created like a food event so that people can come together and enjoy food. And after kind of creating this, they developed like a set of recipes that people kind of brought together from that engagement. And then the last one is hold public meetings in communities and make them easy for them to participate. So compensate people for their time, for their effort to go there, and instead of doing them like in like organization, like in a building of the organization, go to their places, go to where the community is and go there. So from Native Nations, we heard we have been going into the powwows and we're talking with people there. We're going to community centers and we're hearing from people what is it that, like, what are their needs in terms of transportation, and that can help shape that investment in transportation planning. And with that, I finalize my presentation.
Thank you,
Thank you
Camilla,
so
so
much.
much. This was great. And we have the next presentation all ready to go. Bill, Julie has that in hand. So everyone, Bill Goff, thank you.
Okay, I'll try to make up time on this one just because of the delays, and I want to respect people's time here. So this was a project that was started, and the point person at MnDOT was Gloria Jeff. And interestingly enough, Camilla Fonseca and her team were at CTS the creators of this project. So I feel a little awkward. It's like singing a cover song in front of the person that made it famous. So I'll do my best. So if you could go to the next slide, please. So, really what we're talking about, you're going to have to, yeah. So the methodology with the spaghetti junctions and the impacts on communities and how various DOTs are trying to address it. Now you're going too fast. Yep, thank you. So, the question was at the outset, how are these projects addressing adverse community impacts of spaghetti junctions and really kind of large highway infrastructure situations? So the methodology is they did a literature review, a nationwide scan of like projects and situations. They highlighted 8 case studies. So after this, we can send you a link to the study, and I'm going to highlight a couple in the next few slides here, and then talk about successful practices that MnDOT Metro District is utilizing. So just the comfort in this is that MnDOT as an agency is practicing this, and really the whole theme of this is that never be afraid to lean on other DOTs and look at their situations and how they're addressing and learn from them and try to do better. So if you could go to the next slide, please. So, the literature review, they looked at 3 things, 3 silos. We can keep the community impacts, environmental impacts, and then economic impacts. So I won't go through these individually, but it's fairly obvious of what sort of impacts large infrastructure, transportation infrastructure has on adjacent and surrounding communities. Next slide, please. So we looked at 3. The scan looked at. Oh, thank you. Looked at 3 projects focusing on mitigated harm. These are 3 approaches. So really, the obvious one that is all the rage the last decade are freeway caps, and reutilizing the space above highway infrastructure. We also looked at highway underpass areas, and then also one that's getting a lot of traction and attention is, especially locally with 994, is a move to remove or reconfigure. So, you look at freeway caps. We have examples in Minnesota that we've done. I look at the highway underpass areas and the work that Lisa Austin is heading up, particularly in Minneapolis. And then removal and reconfiguration. There are examples nationwide of removing antiquated or underutilized highway infrastructure and reconfiguring and making them calmer, making them more community friendly, neighborhood friendly. So if you could go to the next slide, please. So the approaches, as I highlighted, tend to look at DOTs tend to look at it from a complete streets position. They look for greenification. They look at arts, and I think most importantly, community involvement. Next slide, please. So I'll just highlight again, as I said, there was eight examples, highlighting a couple. One that's Clyde Warren Park In Dallas, that's a completed cap that has done. And then another one they highlight is the Stitch. This one is currently in development in Atlanta. Um, these are a couple examples. Again, in the study, there are 8 total, some interesting examples. So I highly recommend, and as I said, we can send you a link to the study, and you can review the various approaches that were highlighted by Camilla and her team, Camilla Gloria and her team. Next slide, please. So, underpass areas, we look at the underdeck, and we looked at the underdeck as one example in Miami, and then the Marquette interchange in Milwaukee. And as I highlighted, I look at what like Lisa Austin headed up in downtown Minneapolis, in the area of the ABC ramps. And there are other examples currently in the works in downtown Minneapolis. So, the case study, we highlight these kind of underpass areas of utilizing them, making them more community friendly, aesthetically pleasing, really just kind of a complete streets approach to rehabilitating what have historically been very stark, dank areas. Next slide, please. And then we talk about removal and reconfiguration. The Detroit example is kind of a milder scale. That's one that Gloria really pushed to get more information on, as her expertise and knowledge and having lived in Detroit. So she was aware of this one. And then the inner east and inner north loops of Rochester, where you had somewhat underutilized stretches of interstate that were reconfigured and rehabilitated into more kind of passive transportation corridors that were more positively impactful to the adjacent neighborhoods and communities. Next slide, please. So key findings, again, this is in the study, but the projects are highly localized, very contextual. I mean, really, the intensive working with the communities in the neighborhoods to try to address these negative impacts and enhance their community needs. The structure and the government's, with the finished products of who operates and maintains varies. And then project designs are based on community priorities as well as technical aspects of the transportation infrastructure. And, the primary aim is to draw people back into the space and reconnect communities. And then it provides coordination. It requires your coordination, these type of projects. And that's the key is there has to be collaboration. There has to be, we have to work with the communities. We have to be bold. We have to be innovative. That's kind of I think the biggest takeaway is, as an agency right now, MnDOT, yeah, we are doing many of these things and we're doing them well, but there's always got to be the need to do better and to be bolder and more innovative. Next slide. Perfect. So you might have to, I think thank you. So key findings of the case studies: engagement. We talk about engagement, changes in practices rather than changes in policies, and facilitate project implementation and success. And then intentional, iterative, repetitive engagement with local transportation stakeholders and the general public is critical. These kind of one-off or engaging the community at kind of historic touchstones are, I think, kind of a thing of the past. There has to be constant and consistent engagement and outreach and coordination with local partners. And as a side, yeah, okay, perfect. And then what does meaningful engagement look like? The engagement is a process rather than an event. Okay. That it has to be innovative, it has to be creative. We have to think about new ways to reconnect with underserved communities. We have to be collaborative. We have to be flexible and iterative. What I mean by that is it has to be constant and repetitive. We've got to be out there and then different from NEPA style engagement in the sense that there is kind of a prescribed method and way through NEPA. And I think we have to not be afraid to go beyond just kind of those minimum standards. And we have to be out there in the community on a constant basis. Next slide, please. So review successful practices. You know, when we compare it or meld it into the livability framework. Next slide. So trust is paramount. Trust is key. You know, we have to be able to try to reestablish or establish trust in these underserved communities. We have to equity. We have to recognize the inequities associated with the previous practices and the way we did things. Next slide, please. You know, health and the environment. You know, when we look at these spaces, and we try to repurpose them, we have to look at, you know, from a green standpoint, and we have to approve the aesthetics and the appeal of these areas. And we also, you know, we have to improve the activities and the access to them. Economics obviously incorporate, you know, our business community is the lifeblood of our cities and neighborhoods. And economic prosperity, economic well-being is paramount. Sense of place, again, you know, we talk about complete streets and all that. We have to have strategies and approaches and practices and designs that improve and enhance the sense of place and these critical communities. Next slide, please. And connectivity. Complete streets is you know, connectivity for all modes of transportation: bikes and peds, transit, access to jobs, access to neighborhoods, as well as you know, vehicular operation. That is just one component of equal connectivity. And then safety, creating a sense of place and a sense of comfort, not only from a operational standpoint, but also from a community standpoint. We want these places to be safe places for the residents. Next slide, please. How do we define success? You know, success is innovation in the process of engaging our community and stakeholders, to being innovative, being risk-taking, being comprehensive, being a partner. Success is aligning between community goals and project outcomes. It's not just, historically, it's always been what are the needs of the highway system or the street system or the network system. Now it has to be all encompassing. Everything is interrelated, and success is the outcomes is highly contextual. It's in the eye of the beholder, and what is success for one party may not be success for the other. So there has to be an equal understanding. An example that I talked about that inner loop east and inner loop north. In the Q&A, I could probably have Camilla speak to that better than I. But if we can go to the next slide, please. And that's it. So, I mean, I jammed through it, and I apologize. I'm trying to make up time here to respect everybody's time here, and also that our final speaker has an opportunity to comfortably go through the slides. Thank you, folks, and I'll be around at the end.
Thank you so much, Bill. Cadence, are you able to share from your end, or will you need us to assist in that?
Let me try and see if this works.
Sounds good.
All right. I seem to be having the same issue of not being able to share the
Okay.
file.
I will
Julie's
share.
had the best batting average. Okay, thank you, Julie. And Cadence will present improving transportation equity for all by centering the needs of marginalized and underserved communities. Thank you so much.
I will also do a little bit of an abbreviated speed through of some of the introduction slides, just so that we have time to read through some of the quotes. And so next slide, please. So this study was funded by MnDOT and was conducted at the University of Minnesota by Yingling Sun in 2023. And they looked at 10 different communities to understand the impact of inequities on people who are really at those margins of our transportation system. And so these 10 communities that were interviewed include the Latinx community, African American, people with disabilities, immigrant community, aliveness community, Fergus Falls, Hmong community, single mothers, White Earth Nation residents, and single fathers. For this particular presentation, I will only highlight some of the findings and interviews from two of the communities. So if you go to the next slide, please. And so those two communities are transitioning home residents in Fergus Falls in the White Earth tribal community, and then people living with HIV as part of the Aliveness Project. Next slide, please. So the reason why this study was conducted was to gain experiential knowledge that emphasizes the lived experiences, assets, and needs of these communities. The researchers also wanted to uncover more information to really develop a deeper understanding of people's experiences in their communities and the role that transportation plays in it. So they did meet with the interviewees between 10 to 45 minutes to really discuss specific issues related to transportation. Next slide, please. So for our first case study, we'll go over some of the experiences learned from home residents in Fergus Falls and White Earth tribal community. Next slide, please. So Fergus Falls is approximately 185 miles northwest of Minneapolis. It has a population of almost 14,000 people in 2023. And it is a community that cares about safety and mental well-being. They have a mission to plan for the future of their citizens, to provide resources, opportunities, and environment to ensure the best possible quality of life. They also emphasize a place to belong, which includes providing a safe, comfortable, and supportive environment for persons with serious mental illnesses who are working on their recovery while living in the community by means of voluntary, recreational, social, educational, and community service opportunities. Next slide, please. So in this particular community, there are a few available modes of transport, but they're not available for all people in Fergus Falls. So while there is the Otter Express and Productive alternatives that can provide on-demand bus services for $2 per trip, they're on demand. They don't run all the time. There's also a shuttle taxi service within Fergus Falls, the city boundary, and they charge $9 per trip. The other available modes are anyone who has access to a private vehicle, or folks in this community often rely on rides offered by family members. In this community, the modes of transport that are not widely available at all, they don't really have any rideshare via Uber or Lyft. There isn't a regular bus service. They don't have any type of rental car or car sharing program like Zipcar or carpooling. And many people, even if they can ride bikes, they don't have the same bike share access. So no Lime, no other service providers are in this area. Next slide, please. So I'll read a quote from someone who is a primary caregiver to their spouse. And this quote states from the wife about her husband: he has lots of options for rides. He's got UCare transportation, there's Doyle transportation, there's Cozy Cab. There's several different transportation services only for medical or counseling. But for me, I only have one. And if I have appointments out of town, I have one company, and that's the county. And they provide transportation for me out of town. It's really hard because if that person who usually takes me is filled up, I have to cancel my medical appointment. I've had to miss quite a few, or else they got a cold and get sick. They don't have a lot of volunteer drivers available right now, so it's very limited. So this person's experience really highlights that her husband has more resources than her that she doesn't qualify for. And even when there is some type of volunteer program, it's not as reliable as other options are for her husband. If we go to the next slide, I'll share another quote from someone in White Earth. We're really rural. that we have a transit. It gets people to work from 8 a.m. to 4:30 p.m. Monday through Friday, when other than that, there's a lot of swing shift work from 4 to midnight. A lot of people work around our area that people work, but there's no public transportation after hours. So that affects a lot of people. This person's quote really speaks to the fact that second and third shift workers cannot take transit. It doesn't get them there in time for their shift once it starts. The service has already stopped running. And then for people who are getting off later or going into work in those after office hours, they don't have a transit option to really be able to even utilize. Next slide, please. This is another quote from someone about their experience for Native Americans. A driver's license is a barrier. We're on the reservation. I know a lot of men in the area here are with either child support or DWI, driving while impaired. They got their license taken away, and there's a huge population in the men in our area that are not eligible for their license. So this quote really speaks to the experience of people who get essentially locked out of being able to drive and operate a private or shared vehicle. For those of you who also don't know or didn't know this, if you are unable to pay child support, sometimes your license can be taken away, which then really impacts someone's ability to get to work, to earn an income, to pay that child support. So it does create this really vicious cycle for people who are really trying hard to get out of the margins. Next slide, we'll move to the second case study. These are quotes from people living with HIV and are members of the Aliveness Project in Minneapolis. So a little bit about the Aliveness Project. They are a community center that's very popular. If you go to the next slide, please. And they often work with people who are experiencing homelessness. They provide daily meals, a computer room, other services that are supportive that aren't typically offered elsewhere. It's really a stopgap for people who are falling into the margins via other systems, not just transportation. And they do really focus a lot on those food insecurity needs to help bridge that gap for folks that don't have those resources. Next slide. So when it comes to transportation and safety, this is a quote from someone in the community. As an older woman, often traveling alone, I don't feel very safe on the train. My son is a transgender person, and he's mentioned the security issues on the train as well. There's a little button you can push, but it's like there's nobody in the car. And continuing quote, I've been called the F word just from standing out on the street corner waiting for the bus, and that limits my want to continue to just exist sometimes. So being an LGBTQ plus person and presenting as such, it is daunting. So this highlights this person's feeling unsafe, being in public space to use a public transportation system and how that contributes to their desire to take transit, as well as continue to rely on that if they don't feel safe. So the last slide that I have for y'all is a link to the study. That QR code can take you there. Otherwise, I can also paste this link in the chat if you want to read the full report. I know I really sped through just to try to give us an opportunity to have a Q&A. So thank you all for your time.
Thank you, Cadence. Thank you, presenters. We do have a few minutes left for questions. Sadly, not as many or not as much time as we'd hoped due to technical difficulties. If you have a question, please put that in the chat and I will read that aloud. Or if you prefer to raise your hand to ask your question directly, please feel free to do that. Let's see, we had a comment earlier from Gina. This was for Camilla's project. Gina says, MnDOT has an equity lens framework that should also be used and can help with this process. So I just wanted to bring that to your attention. Gina, did you have a question that went along with that or just wanted to make sure that was in the dialogue? No pressure to speak. But I'll make sure. Camilla, it looks like you're nodding your head that you saw the comment and you're familiar.
Yes, so we were looking into that as part of the project. we didn't focus a lot on that because we were trying to focus a little bit more on the localities themselves, like how is it that they are doing it, because there is such a variety in the ways they can do it. And they typically like know that that framework exists. But yeah, we know that that framework exists.
Okay, fantastic. And then I don't know if Alex is the first name, I assume. But if time allows, can this team address whether or how you considered the practice of completing health impact assessment or HIA or rapid HIA early in a project, or how this can address many of these topics? These seem to have lost popularity and traction, but are valuable tools that can improve outcomes. Thank you. So I think that probably goes to Camilla and Bill. I think it was timed during Bill's presentation, but there's overlap for you too.
I think, well, Bill, you can talk a little bit more about that, but at least when we were talking with the different states that were conducting the projects that we were looking into, none of them mentioned the health impact assessment. Like that was not something that is on the radar. So I think I'm with you. They have lost popularity and attraction. Although I will say like something that they kind of all mention is that they have been looking into like the NEPA assessments, and the kind of community engagement that you do under that NEPA assessment is very limited, and you really have to go beyond that to really engage the community to kind of understand like how the project will impact them, and from there address that need. So they were trying to really like go out from that framework, and they were trying to work together with the localities that again know better their communities, and they may have like a better contact with their communities to kind of engage them again to see like what are the impacts, how are they getting addressed. And we also heard kind of that community like feedback loop. Like once you go to a community, you propose like this is the project, this is what we're going to be doing. You hear their concerns, and then you go back and say like, we heard these regarding this point, we can do this, or we are recommending these other things. Kind of listen again their feedback, and then like kind of really coming back to the community and say, we hear your concerns. This is what we have been working on. We also heard that in some of the community events, the state officials have been just like sitting there as guests and leaving like the leaders of the community or the leaders of the localities to kind of run the meetings, and they are just there as invitees. So when we talk, I guess when we talk about these kind of assessments that are required, they can improve and they can provide a kind of a context for improvement in the project, but you really need to go a little bit further than that. Just not like the minimum, like do the things for filling the minimum requirements. Bill, do you have any other comments in regards to the health impact assessment?
No, I think you did a fine job, Camilla. I'm going to leave that alone.
Okay, it looks like we have a hand up. Alex A.
Yeah, I just unmuted. Can you hear me?
Yes.
Yes.
Great. Well, thank you for the presentation today. And I love that there's overlap between all this research, some themes of trust and integrity to build this equity, early inclusion. I have a kind of a real world example to respond to. You don't have to address it specifically because it's not related, but maybe you could talk about research you've seen from other places. But essentially with the I-94 project, a lot of the community and neighbors are asking for the boulevard option to continue. And you reached out early, you brought together community members, you developed a policy advisory committee, but now we're at the stage where like decisions are being made and the neighbors are asking for that option to continue. And looking at your research, like integrity is the thing that kind of sticks with me the most. And my question is, like, I think the integrity is degrading a little bit, and that's emblematic. Right now, it's the first official public comment period for this I-94 project, and it's happened during the entirety of this federal takeover of our state. And so who has capacity, especially vulnerable and underserved communities, to read 443 pages and document right now their genuine comments? It's just fascinating that they're just moving forward, and it just seems disingenuous, therefore an erosion of trust. So like the question is like, how can MnDOT like pause, go backwards, build trust again? Because it just seems like a lot of people are losing energy for valid reasons. Thank you.
Yeah, and I don't think I have a good answer to that. We are kind of in a, yeah, like different times. So it's really hard to kind of build that trust when there isn't funding available to continue the projects that you mentioned you were going to be doing. And that is helping build the trust in the community. Like it's really hard. So I don't think I have right now a good answer to your question.
I'll respond to that. Just Julie Swiler. Because I don't think we have any of our folks from the I-94 project here to respond. So I would be very happy to pass your concern on to them. And I think you would get an answer that would be more satisfying to speak directly to those folks. So I will pass it along.
Sure, totally understand. Thank you. I will go to the public meeting tonight and ask the same question. But if the presenters are thinking about this in like other states that have an erosion of trust, and if there are strategies that state agencies or others have made to rebuild trust, I know it's like complex and nuanced, but if you have any ideas of how we can repair our system here, that would be great. And I can follow up via email too with you all.
Thank you, Alex. We are at time. If the presenters have extra time to hang out for a couple of more questions, that would be great. In the chat, we have a question from Christine. Did Camilla Fonseca say pay for community-based organizations expertise? How would we do that, please?
So what we heard in our kind of work with the localities is that sometimes, well, also like we're working with the Spaghetti Junction project, it's like typically the work of the community-based organizations, it's taken as like granted or like as a voluntary in some cases. So really what we have heard from other in other contexts is that you have to recognize their work, their expertise, and kind of pay them like their fair share for the work that they have been contributing. How will we do that? I mean, even if they say like we're gonna be voluntarily, and it's like we want to recognize the work that you're doing. If you can like budget for the work that you have been doing, like willing to pay for that. But it was really more into that. Like sometimes it is more like as a voluntary basis. And what we have heard is like recognize the work that they have been doing.
Okay, thank you. I'm not sure if it's first name Derek or James. Is MnDOT considering any legislative proposals to address the myriad access issues for underserved communities identified? Are MnDOT proposed transportation projects filtered through these lenses? Oh, Derek James, Environmental Law and Policy Center. Thanks, Derek.
This is Julie again. I'll do that one because I'm going to give a similar answer to the last one. We'd want to check with our government affairs folks on that, and I'm happy to also follow up with you on that one.
Thanks, Julie. And then another question we have from Andrea Erickson. I work with senior citizens living in independent apartments with 325 residents where layers of transportation options are needed. There are many holes in the available resources. Is there someone to partner with to come up with creative solutions? I wonder if this one is meant for Cadence.
I would interpret it that way. Yes, I can take a stab. So I do know that there is interest from chapters of AARP to help their membership find transportation. It is very patchwork and multi-layered, of course, and it's very specific to where maybe a like senior living facility might be, what the immediate adjacent pedestrian transit environment might look like. So I would look towards more organizations that are geared towards working with folks who are older. But it's definitely something that requires a lot of energy, and I know that there are very specific needs, and it's very localized depending on where you live in the state. Some communities have much greater access to on-demand transportation, which is heavily utilized by folks who are needing to get to medical appointments, but it does become a lot more challenging in less urban and ex-urban areas. I know that doesn't fully answer your question, but I do know that like folks in the like Fargo Moorhead area, AARP has been interested in getting their senior populations better connected with transportation, specifically for medical appointments.
Thank you, Cadence. Looks like we have one follow-up from Christine. One other issue that wasn't raised is having childcare available for underserved communities.
I
And
can also just point back to the study that Yingling Fan did through the U of M. They did do interviews with single mothers and single fathers that will address some of those issues. We just didn't have time to present on all 10 of the community case studies in this particular presentation.
Thank you.
well, thank you, everyone. Thank you for joining us today. We hope you'll join us for the next webinars in our series. We will follow up with you via email with a link to a recording of today's presentation, information about upcoming Research Radar webinars, and links to the resources we've shared today. This concludes our webinar, and thank you so much for attending.